in those regions.
We found that in the eastern districts where the mother project is and where we are more familiar with what is taking place, there has been improvements in the number of facilities at district level reporting comprehensive support supervision across the different service areas.
The Ministry of Health recognizes the importance of the data generated through health facility assessments, which complements other data sources available to the ministry.
Health facility assessment is very important because it goes in detail really to find out the actual generation of data and how the data is used. What is important is to see how we can link the health facility assessment that is done by the STAR-E, Lqas, to the National Service Availability and Readiness Assessment, so that the tools can be linked and talk together. But I think this is a very useful exercise.
To promote the use of data, districts are also supported to conduct the Service Performance Assessment and Improvement process, which uses the Lqas Community Surveys data, facility assessment data, and any other routine data to identify priority gaps, analyze underlying causes, and develop action plans to address the gaps using the available resources more efficiently. District officials are taken through 7 steps in a 2-day process, which involves identifying gaps in priority service areas, choosing priority indicators, and analyzing underlying causes in order to come up with the interventions elaborated in a district improvement plan that can be implemented and monitored. At the end of the SPAI exercise, the district teams present their plans to their district leaders for buy-in and ownership.
What they normally do in their districts is a long-term plan, but this is a short-term plan. It is rapid improvement. They want to improve something with the resources they already have in the district. In most cases, they don't ask for additional funds. They are going to use what they have in the districts to bridge up a gap that they identified.
I've really seen something I'd never come across. We have resources at our disposal, but the way we use them. This SPI has enlightened us on coming up with integrated work plans, so that when we are implementing one activity, we can really make a package of a number of activities, and you find like we are using more or less similar resources to meet and to achieve a number of targets.
To further promote the use of data and learning, STAR-E also organizes information sharing meetings which provide a forum for districts, implementing partners, government ministries and other stakeholders to share their experiences in implementing Lqas surveys, health facility assessments and the use of resulting data. The meetings have provided an opportunity to discuss district capacities and strategies for continued district-led application of Lqas processes and sustainability. During the information sharing meetings, districts share experiences in implementing Lqas community surveys, facility assessment, and how they have used the resulting data. While many districts now report adequate human resource capacity to undertake Lqas surveys and assessments, lack of financial resources still hinders their ability to sustain annual Lqas community surveys and facility assessments.
We have the skills, we have the human resource, but then there are some other areas, like on facilitation. We may not go out hore, as STAR-E and STAR-E start going out hore. But if we can say, let us sample a village in a sub-county, we can do it as a district.
Right now, I'm confident to say that many of the districts actually have the capacity within themselves to continue this exercise even beyond our own program life. And actually some districts, like for example Namutumba in our geographical area of coverage, have already gone ahead and done their own Lqas surveys for their indicators that are beyond what we support in HIV, AIDS and TB. So I'm really confident that it can be sustainable and continued by the districts beyond our own program life.
The USAID-funded Strengthening Decentralization for Sustainability SDS project is currently providing funding to support 35 of the districts for district-led application of Lqas surveys.
We want to monitor whether the support that USAID SDS project is giving is really having an impact on social service delivery. So the Lqas data generated are very useful for us to monitor whether there's any improvement in terms of accessibility, in terms of care and support. So that is how we are using and benefiting from it.
As part of efforts to facilitate institutionalization of Lqas methodology, STAR-E is working with several universities to include the teaching of the Lqas methodology in training curricula.
What we have done is we've tried to incorporate Lqas in several of the curriculum we are running. In some cases, we are doing it as an introduction to there's a class which is a probability class. A lot of the Lqas methodology is at that level of probability, so we introduced that, and that is more general for everybody to get exposure.
We have incorporated into our curriculum for both undergraduate and postgraduate training the Lqas approach. Then in addition, we are requesting people to come and give occasional training sessions at our campus for our members of staff.
Uganda has one of the best examples of Lqas in Africa. There are a few other countries that have taken it on. Part of my dream is that as things become more and more mature here and new generations of Ugandans become trained in Lqas, that they'll be able to provide technical assistance to the districts, but also to other countries.
The Lqas methodology has proved its usefulness as a simple, low-cost and effective tool in providing evidence for annual and other short-term planning and decision-making processes in local governments, projects and other institutions involved in community development. The challenge, however, remains to ensure its entrenchment and sustainability in routine monitoring and evaluation mechanisms in local governments.
When you collect this information, you are empowered. You are able to make a statement with fact. Even when you are talking to the community, if you say that the disease incidence is shown by this graph or by these statistics, it will make sense and even be able to be a point of even resource mobilization, because you say, I have a problem, it has been quantified so much, and therefore we want that kind of support. So we are looking at a possibility of how it can be mainstreamed and utilized subsequently in the local governments.
What we've done in these 5 years is to plant the seeds, which are germinating now, but they will need to be nurtured to ensure that the fruits will continue to be harvested from the fruits with the seeds we've planted.